from Liaquat University of Medical Health and Sciences from Hyderabad, Pakistan. The best part about being in medical school for me was learning new things and knowing that a lot of it will actually come in handy when I started working, which is true. And the most challenging part for me being in medical school was competition, a lot of responsibility, and time management. A piece of advice that I would like to give to all of you is respect your time and space. Med school takes a lot of focus, concentration, commitment, and sacrifice. Set your goal and never quit. And today the topic of my presentation is acne. So what really acne is? Acne is a skin condition that occurs when hair follicles become plugged with oil and dead skin. It causes whiteheads, blackheads, or pimples. Acne is most common among teenagers, though it can affect people of all the ages. The most common causes include genetics, hormonal changes, bacterial factors, and family history of acne also plays an important role. Acne usually appears on the face, forehead, chest, upper back, and shoulders. Depending on its severity, acne can cause emotional distress and scar the skin. Symptoms of the acne includes whiteheads, blackheads, pustules, nodules, and cystic lesions. Here you can see in the picture these whiteheads, which are closed plugged pores. Blackheads are the open plugged pores, some pustules, some large painful nodules. Diagnosis is pretty straightforward. It's through history collection and physical examination. The goal of medical management are to reduce the bacterial colonies, to decrease the sebaceous oily gland activity, to prevent follicles from becoming plugged, to reduce the inflammation and minimize the scarring. There is no predictable cure for acne, but combinations of the therapies can effectively control its activity. Topical treatment is all that is needed for the mild to moderate acne, and for systemic treatment is required for severe and extensive acne. Topical pharmacological therapy include benzoyl peroxide, some antibiotics for topical use, salicylic acid, and Dapsone. For oral medication that is used in severe cases includes antibiotics, oral contraceptive pills, anti-androgen agents such as spironolactone, and Accutane, which is also known as isotretinoin. But we have to be very careful while prescribing for Accutane because it cannot be used in the pregnant females as it can cause some severe side effects in the fetus. So we have to be very careful while prescribing that. Some lifestyle modifications, wash face and problematic acne-prone areas with gentle cleansers. Try over-the-counter acne products to dry excess oil and promote peeling. Avoid irritants such as oily cosmetics and hair styling products. They can sometimes irritate the skin. Avoid touching or picking acne-prone skin. Protect your skin from sun. It's very important. So a good sunscreen coverage is very important to prevent from the scarring and pigmentation which can occur as a result of acne. Then coping and support. Acne and acne scars can cause anxiety and may affect social relationship and self-esteem. As a physician, it is very important to assess the level of anxiety of person dealing with acne and address it. Thank you very much and good luck.
Excellent. Thank you so much, Doctor. And we'll go to the next speaker.
Hello, everybody. I'm just going to share my screen. Okay, can you see my screen?
Yes.
Thank you very much. So hello and good afternoon to everybody. My name is Dr. Twisha Ejner. I'm a general practitioner. I did my MBBS from India, from Rajiv Gandhi University in 2019, and I've had some experience working in both clinics as well as hospital. So for me, medicine has been mostly about connecting with people and helping them in the most vulnerable times. And something that I really enjoy is that every day you go into work, you're learning something new and there's no limit for your knowledge. So that's something I really, really enjoy. My advice to you as students would be mostly respecting your patients, your colleagues, and your profession. And if you really, really, really want to learn, the best approach is to have a practical approach and interact as much as possible with patients. So today's topic is going to be about contraception, and you may know a little bit about it, but we're going to be talking briefly about the different types. So what is contraception? It's essentially the different birth control measures that prevent pregnancy. There are a lot of options available, and there is, for each patient, there's a different approach that needs to be taken depending on what they prefer, what kind of contraception they're comfortable with, and depending on their medical history as well. So contraception for different people can mean different things. For some people, they want it to be long lasting and they want it to last for many years. For some people, it needs to be short term. So an ideal contraceptive is something that meets everything that's written over here. It's safe, it's effective, it's long lasting, it's acceptable, it's not expensive, it can be reversed, it's easy to use, and it's independent of sexual intercourse. So far, there's no ideal contraceptive, but again, it depends from person to person and which aspect they're willing to compromise. So there are two kinds of contraceptions. There are hormonal and there are non-hormonal. So when you talk about hormonal, they contain some hormones. That's estrogen and progesterone. So sometimes they also use just progesterone options without using the estrogen. So this can be taken in different forms. It can be in the form of pills that are taken every day. It can be injections. It can also be in the form of devices. So you see the IUD over here, it's an intrauterine device that's inserted into the uterus and it releases the hormones. You also have vaginal ring, you have implants that are put under the skin, and there's a patch that can be applied on the skin. So all of these different forms, they release estrogen and progesterone. So the important thing over here to remember is that they're very, very effective, more than 99% effective if they're used correctly. And there are also certain limitations with this. The fact that individuals who have heart disease, who have very high blood pressures, cannot be taking these medications or these contraceptions. So for them, we do have some other options. So let's see what they are. We have something called as non-hormonal contraception. So these are barrier methods, like for instance, they have male condoms and female condoms. And we also have something called as a diaphragm or cervical cap or sponges that are used to cover up the cervix or the vagina, the inner part of the vagina, and they prevent the contact between the sperm and the egg. And you also see another thing over here, which is the copper T. So it's an IUD again, and it's covered with copper, not hormones this time. And some individuals who have completed their families, they prefer to have surgical options. Like, for instance, there is vasectomy and tubal ligation, wherein you prevent the release of the eggs or the sperm. Now, all of these methods are pretty good and they are pretty effective. It depends on the patient preference and what they like to use. It also depends on the failure rate and how comfortable they are using it. But sometimes if the contraception is not used correctly or if there has been unprotected sexual intercourse, there is need for emergency contraception. So that time you can use some morning after pills, or you can also use the copper T intrauterine device. So as you can see that there are a lot of options available and each patient is different. So the important thing to remember over here is to take a thorough history to understand what the patient wants and to make proper physical examination, ask them about their family, and take it from there. So that's all about contraception. Please let me know if you have any questions. Thank you.
Excellent, doctor. So we will have questions at the end, okay? But if anybody has a present question right now, we can ask.